In 2022, Pakistan suffered massive flooding that displaced 33 million people, damaged 2,000 health facilities, destroyed 1.1 million homes, injured 12,000 people, and killed more than 1,700 persons. In response, the World Health Organization partnered with the government of Pakistan and the authorities of 4 provinces and 2 federating units to refurbish 432 priority health facilities, labor rooms, and training halls in AJK, GB, KP, Balochistan, Sindh, and Punjab. The intervention, completed in August 2024, drew on the expertise from WHO Country Office, the regional office and headquarters, with the support of international partners such as the government of Japan, Norway, Canada, USAID, and Gavi, the Vaccine Alliance. The goal was to mitigate immediate health risks while supporting recovery efforts and long-term resilience for the affected areas.
पोइ असां पंहिंजा सिर्फ़ु ॿारनि जो पंहिंजो सिर कढियासीं, ॿियो का शइ करे न सघियासीं। बाक़ी जॾहिं इस्पताल ठठो तो हिते ग़रीब आवाम खे हर शइ मिले पियो।
तकरीबन हमारे पूरी हेल्थ फैसिलिटीज़ में 8-8 फुट पानी ठहरा हुआ था, जिससे हमें बहुत डिफ़िकल्टीज हो रही थी।
सैलाब से ये सारा डूबा हुआ था, हमारी पूरी दीवारें वगैरह रिपेयर हुई हैं और अभी हम जो है ना सेफली यहाँ पे बैठे हैं। डेली की जो हमारे पास ओपीडी होती है 300 to 400 हमारे पास पेशेंट आते हैं।
तव्हांजी बाजी महिरबानी, असांजो ॿार सहूलियत सां तव्हां करायो ॿार जो। अॻे ऑपरेशन थिए पियो, हाणे सम्झो नॉर्मल सां हिते थी वियो।
The 432 refurbished facilities are providing now health support to Pakistani communities in 116 priority districts across 4 provinces and 2 federating units. WHO stands side by side with the health workforce in Pakistan and will continue doing so.